The role of community health workers is to screen women for early pregnancy and early referral for antenatal clinic, identify unimmunized children and refer them to clinic for immunization, screen for HIV and TB, contact tracing for diagnosis and starting treatment of a contagious disease. This video will inform the community health worker about the importance of vaccinations to prevent vaccine-preventable diseases. By the end of this video, you should know which diseases are vaccine-preventable and learn briefly about the immunization schedule, the importance of vaccinating children and how vaccines work, how to promote vaccinations as a preventative measure, the possible adverse effects after vaccination, the reasons for vaccine hesitancy and arguments against it, and where to find further information on vaccines. This video will inform the community health worker about childhood vaccinations. Vaccines are substances that help the body's immune system protect against future infections. Essentially, when we vaccinate a child, it means giving the child a small, harmless amount of an infectious virus or bacterium. Vaccines can be given through injection into the muscle or skin or orally. Vaccines help strengthen a child's immune system so their body can fight off infections if they are exposed to them. There are many vaccines that have been approved to be given to children in South Africa, as can be seen in the Road to Health booklet. Over the years, vaccines have prevented many diseases and saved millions of lives from diseases like chickenpox or varicella, diphtheria, flu, influenza, hepatitis A, hepatitis B, Hib, Haemophilus influenza type B, measles, meningococcal, mumps, pneumococcal, polio or poliomyelitis, rotavirus, rubella, German measles, tetanus, lockjaw, whooping cough or pertussis, and of course the more recent COVID-19. These vaccines are safe, licensed and approved to be administered in children and adults, as can be seen on the vaccine schedule. The recommended time to give these vaccines is properly outlined in the vaccination schedule and catch-up schedule. Vaccines remain an important first line of defense against infectious diseases, particularly in children less than 5 years old. A child's immune system develops over time, and therefore they can easily get infections when they are still young. It's important for community health workers to note that a child who misses vaccinations can become ill with life-threatening diseases. Therefore, all caregivers must be reminded that childhood immunizations are extremely important. Vaccinations protect the child receiving them, as well as other children in the community, from the unpredictable side effects of serious infectious diseases. Vaccines have been studied more than any other medications and have been proven to be safe and effective at preventing diseases. When vaccine coverage is high in a population, it helps to stop the spread of disease. When it is low, the risk of an outbreak increases significantly. Parents who choose not to vaccinate their children do not only put their own children at risk, they also threaten other children in the community who can't receive the vaccine because they are too young or have compromised immune systems or for some other medical reason. There are still some people that struggle to see the benefits of vaccination for many reasons. Some reasons for vaccine hesitancy include fear of side effects, believing anti-vaccination content on the internet or social media, not believing in the usefulness or safety of vaccines, distrusting the motives behind promoting certain vaccines, unpleasant experiences such as pain during previous vaccination consultations, disruptions of medical services such as a pandemic, local conflict or displacement. Community health workers are advised to address the message of vaccine safety in the community, assuring the community about the benefits of vaccination. Immunization protects young children against potentially life-threatening illnesses. Parents and caregivers protect your children by making sure that they have all the required vaccinations at the right time. It's free in all public clinics. These are the key messages. Vaccines save lives. Vaccines protect children from dangerous diseases like measles, polio, and diphtheria, which once caused severe illness and death. Thanks to vaccines, many of these diseases are now rare. Vaccination protects the community. By vaccinating your child, you're not only protecting them, but also others around them, especially those who cannot get vaccinated. Vaccines are safe. Vaccines are thoroughly tested for safety and are used to protect millions of children every year. Side effects, if any, are usually mild and go away quickly. Don't delay vaccinations. It's important to vaccinate your child on time, as children under 5 are more vulnerable to infections. Vaccinating early ensures they have the protection they need when they need it most. Prevention is better than cure. Vaccines are the best way to prevent serious diseases and ensure a healthy future for your child. Vaccine-hesitant individuals should be referred to the Why Vaccinating Your Child Matters from the NICD for more information. An adverse event following immunization, or AEFI, is any health event that takes place up to 3 months after a person has received a vaccination. Vaccines may cause mild symptoms such as redness, fever, irritability, and swelling at the injection site. Caregivers should observe the symptoms, and if they do not get better, refer to the clinic. If there are any suspected cases of adverse events in the community health workers must advise and refer those to the facility. In the case of a mild reaction, the community health worker should advise the caregiver to place a cool, damp cloth over the injection site to help relieve the pain. Medication for pain or fever can be given according to clinic nurse instructions as to how much and how often. If the injection site looks very red, swollen, or has pus, the caregiver should take the child to the clinic. A problematic practice after immunization is the use of non-prescribed medications, including herbal remedies, based on the belief that they will minimize side effects. Please educate caregivers not to apply Vicks or other herbal medications on the vaccination site. If the child is very hot and the caregiver is worried, they should take the child to the clinic. Community health workers should also refer to the Road to Health booklet and the latest Expanded Program on Immunization, or EPI, schedule. Amayeza Information Services also provides great information about vaccines. Here are their contact details. And also the Medicines Information Center details. Thank you for watching this video and for doing your part in educating your community, ensuring that vaccinations are effective in all communities.